Hi everybody, Dr. Anjana Bhana here, and welcome back to my YouTube channel. Today we're going to be discussing treatment comparisons. We're actually going to compare something newish called exosomes. So it's taken the aesthetic world by storm. Exosomes versus another sort of regenerative therapy, PRP or PRF. So regenerative medicine and regenerative therapies are now the buzzword, along with biostimulation. So basically using your own body to heal itself. So in this tiny little bowl, there is 1 ml of an exosome solution, and there are about 2 billion exosomes in this 1 ml. And then I'm going to be comparing it to, well, these are empty, but you guys have seen me do it plenty of times, PRF treatment. So these are the tubes that we use. So what is the difference? So what is, like, you know, or what are exosomes? So exosomes aren't actually cells. They are membrane bound vesicles, so like little membrane bound little bubbles that are, you know, derived from the cell. So they've got this phospholipid layer, the same as a normal human cell, and then inside them are lots of little messengers. So mRNA, messenger RNA. So they've got DNA in them, and they are derived from adipose cells, from stem cells, from bone marrow cells, skin cells. So they come from cells, and they are messengers that tell your body to heal and regenerate itself. And then what is platelets? What are platelets? So platelets are actual cells. So they're cell derived, and they come from your blood. So you are taking bloods from yourself, 2 to 4 vials, usually in a face and neck and hairline treatment, and then it's spun around in a machine called a centrifuge. The centrifuge separates the cells into red blood cells, platelets, as well as some white blood cells, and something called mesenchymal stem cells, and that is extracted and then injected into the skin. So how do they differ in terms of regeneration? So just remember, this is from your own body, and the exosomes are derived from mostly bone marrow and adipocytes of other people. So sometimes they use the fat from young women having liposuction, and they derive the exosomes from that, but it's not their cells, it's not their bodies, it's nothing like that. But you know, therein comes the decision for yourself, like what would you like to have done. And then using PRF or PRP sets off some sort of inflammatory response in your body. So there's some inflammation, and that inflammation leads to regeneration. With exosomes, it's a non-inflammatory regeneration. So these little vesicles, these little messenger bubbles are telling your body in a gentle way to regenerate itself. And then it's using your own, you know, PRP is using your own endogenous cells, while exosomes is external. And then, you know, if you are unhealthy, if you are, you know, usually past 65, chronologically as well as biologically, maybe your platelets aren't that, you know, fantastic quality, you don't eat well, so using your platelets might not give you the best results. So that's where exosomes come in. There's been arguments though as well that, like, where are they coming from, the quality of the tissue these exosomes are coming from. So because they're new, time will tell, but I must say we've already been using exosomes and a combination of exosomes as well as PRP in treatments, and we're seeing some great results, especially some great wound healing. So it's fantastic for wound healing. They use it for acne scarring, hair rejuvenation. So it's a great new treatment to have a look out for. If you have any questions about what should be best for you, the best is obviously to go for a consultation, but I'd love your comments. Drop them in the little bars below. Like, share, and subscribe, and more from me in the next video. Bye guys.